Along with the president, 6 people are now confirmed as positive, most of whom were at the Rose Garden ceremony for his Supreme Court nominee a week ago. So more and more, this isn't looking like a Hope Hicks thing, but more like Hope Hicks is a canary in the coal mine. She was evidence of a place where they all were, and now the virus starting to build up in their systems to the point where it would be measurable. The seating chart puts them all close by, not a mask to be seen among them. Now, we also have a list of other people who were there who we are waiting on. Do we have that? At some point, it will appear. And that's important because that's contact tracing. You have to find out when these other people that we're waiting on testing will let us know. There we go. Whether or not Kellyanne Conway is on this is on there, but we know her answer. Mark Meadows came out without a mask today to talk to the press about the president. We don't know about him. Judge Amy Coney Barrett, they're saying, either had symptoms that were COVID-like or had COVID earlier this summer, so they're thinking maybe there won't be a problem there. Melania, obviously, the first lady we know about. Chris Christie's on there. We're waiting to hear from him. Rudy Giuliani was at the debate prep. Not as long as some others, but he was there. It's important to know him, especially with his age and stage. So this just keeps being on there. Campaign manager, no, he is not. He has it. And, you know, we're going to have to keep track of this because even if you've heard, oh, yes, so-and-so was tested, they were negative, we're going to have to wait a couple more days and see them tested again. And as the idea of the president's got to get better so he can get back and get to those rallies before the campaign is upon us and it's over in the election, let's talk to Professor Erin Bromage and Dr. Lena Wen, who, by the way, Lena said this 1 week ago after the ceremony.
Well, I'm very concerned because if I were to custom design a super spreader event, this is what it would look like.
Lena Wen will have to change her name to Dr. Cassandra Wen, because Cassandra is the Greek mythological creature who knew how to predict the future, but it was always bad. So, Dr. Lena Wen, you were right. Of course, we believe, because otherwise, how can you have this kind of coincidence where you have all these people who are at that one event together? So, what does that tell us about what we can still expect from that population?
I think, Chris, we're going to be expecting a lot more infections, and we've maybe just barely scratched the surface of what's going on. So we have to, when we think about super spreaders, we have to look at individuals and events. There was just a very large study done out of India that found that 70% of people with COVID don't spread it to anyone, but 60% of all infections are spread by 8% of people. And so there are people who maybe have a high viral load, maybe they're up and about a lot more. And then if they happen to be in a setting like maybe what we're seeing on Saturday, where they're around a lot of people, there's not mask wearing, individuals are shoulder to shoulder, they're hugging, they're shaking hands, they are greeting each other in ways that they should not be during a pandemic, then maybe it spreads very rapidly that way. So I really hope that contact tracing is done aggressively, and I'm actually rather worried that maybe it's not done the way that it should be, because people who are testing negative right now should not be saying that's done. Rather, they should be saying this is one test and I need to finish my quarantine period of 14 days.
Quick take from you also, Doctor, on the difference between the president and the first lady. The idea that, no, he's doing fine, this is just an abundance of caution. Well, then why didn't she get the experimental drug? Why didn't she get remdesivir? Of course, he's the commander-in-chief, but are these the kinds of steps that you take for somebody who's not having any really significant symptoms at all?
No. And he would not be going to Walter Reed out of this abundance of caution, as they're saying, if he didn't have some pretty significant change in his medical condition over the course of today. And I really am suspicious about the timeline. It just really doesn't make sense that suddenly, in less than a day, that he would have gone from testing positive and having basically very mild to no symptoms to suddenly progressing to the point that he needs to be in the hospital on a bunch of experimental treatments. And so I really want to hear a lot more about what happened. And I also want to hear the answer to when is it that the White House really knew that he tested positive?
Professor, thank you for being with us. What do you think about the idea that Hope Hicks gave it to him Wednesday nights when they first found out, and they tested him 24 hours later, which you'd have to ask, why did you even wait that long? And that's how he got it. It's from that. Does that make sense to you?
It doesn't. I mean, you're completely right. I think she was the canary in the coal mine. She was the one that came symptomatic first. It looks like it was something that happened on the weekend, probably the Rose Garden event or one of the events that happened before or after that, where they were all gathered. What I get worried about now is there's going to be a cluster that are actually at that Rose Garden, but then you know that Hope Hicks, you know that President Trump were both symptomatic. They've spent a few days leading up to being symptomatic where they had a lot of contacts. And if they're one of those people that can move this infection forward, with the number of contacts those people had, this may not be over. And we are still going to be testing, we're going to be contact tracing, we're going to be quarantining people for really weeks after this event.
The decision, Professor, to let him go to New Jersey, the White House says, yeah, we were given clearance by the operations people that was okay. What does that kind of determination look like, and what would they have had to believe or ignore to make that determination?
They would have to ignore literally decades of public health data that sort of says that when you have been around somebody who is infectious, you need to quarantine for a certain period. And we know with this pathogen that it's 14 days. I mean, my family have been in quarantine until we tested just this past week because my son got sick at school. And out of abundance of caution, we tested, we waited for the results, and we got our results today. So everyone was negative and we could go out. We did the responsible thing. What the president did was not responsible, knowing that he had close contact with a person who was diagnosed infected. That is just the pinnacle of irresponsibility.